My name is Dr Haroun Gajraj, Director of the Melbury Clinic VeinCare Centre. In this video, I explain the clinical pathway followed by a patient with varicose veins and superficial venous reflux who has treatment by endothermal ablation here at our clinic. I will cover the patient journey from the initial inquiry or referral from the General Practitioner to the consultation with the vein specialist, from consultation to the diagnosis and the discussion of treatment options, from treatment to follow-up, the enrolment into our annual vein check program, and I will include a brief description of our policies and procedures that underpin the patient pathway and how we monitor the quality and safety of our vein clinic. So here is the clinical pathway, and let's go through it step by step. The Melbury Clinic VeinCare Centre receives inquiries from our website as a result of our informational open events, personal recommendations from previous patients, and from social media sites such as YouTube and Facebook. As a result of inquiries, clients may receive our information pack or our newsletter. In addition to people who self-refer, we also receive referrals from general practitioners, other doctors and healthcare professionals. The Melbury Clinic VeinCare Centre has an excellent reputation with local healthcare providers. Furthermore, our YouTube channel has more subscribers and visits than any other UK-based channel dedicated to venous disease, and our internet presence is designed to provide the public and healthcare providers with information and educational resources rather than to be purely promotional. After an initial inquiry, either by telephone, email, letter or via our website contact form, patients are then seen for a consultation and duplex ultrasound scan. At this appointment with the vein specialist, a full medical history is taken, the patient is examined clinically, and both legs are examined by coloured duplex ultrasound. Based on this initial assessment, the patient will receive a full discussion of the vein abnormality, and there will follow an explanation of all the available treatment options in line with current national guidance. The patient will subsequently receive a full written report. If appropriate, treatment by endothermal ablation will be scheduled at a time convenient for the patient. The treatment is performed under local anaesthesia as a walk-in, walk-out procedure. Thereafter, treatment is followed by at least 2 scheduled follow-up appointments 2 months and 6 months after treatment, which include a duplex ultrasound scan of all the treated veins. Successful treatment is judged clinically and by duplex ultrasound. Additional treatment, if required, is scheduled, and if not required, the patient is invited to take part in our annual vein check program. This annual vein check program, abbreviated to AVC, recognizes that some patients have an hereditary predisposition to vein recurrence, and so by annual attendance for assessment by duplex ultrasound, early varicose vein formation and superficial venous reflux recurrence can be abolished before deterioration and before the development of complications such as varicose eczema, phlebitis and ulceration. As far as we know, the AVC is a service that is unique to the Melbury Clinic VeinCare Centre. If enrolled into the AVC, patients are seen yearly, and if the patient declines, the treatment is complete and the patient is discharged. If the patient has any cause for concern within 12 months of treatment, additional appointments are offered. At every stage, the fees are made clear before intervention. Patients with private medical insurance are offered assistance with their claim, and our fees are published on our website. The safety of our patients as they journey through this clinical pathway is at the centre of our policies and procedures. For example, before a patient is booked for a consultation, our administrative staff complete a checklist of suitability. patients with a significant medical history may not be suitable for treatment in our facility. So, for example, we do not treat patients with a history of heart rhythm disturbance, severe angina, or patients with a pacemaker. This is entirely for reasons of safety. In addition, we believe that it is difficult to treat and follow up patients who live a very long distance away. We receive inquiries from many people in the London area, for example, and for patient safety, we often recommend referral to a phlebology colleague in London. In keeping with guidance from the General Medical Council, we believe that sharing information between specialist and GP is an important part of patient safety. We explain this to all patients who self-refer. We seek their permission to send their GP details of their consultation and permission to request information from their GP. We have specific consent forms to record their permission. All correspondence from the clinic is also sent to the patient. The duplex ultrasound scan is performed with the patient standing, and a very small minority of patients feel faint during the scan examination. For safety, we have a nurse present who can recognize any signs that the patient is feeling dizzy or faint and who acts as a chaperone during the examination. For safeguarding, we have a chaperone policy for the conduct of the examination and a chaperone checklist to record important aspects of the chaperone event. To protect patients from infection, our examinations are conducted by staff wearing aprons and gloves. Staff hand washing is performed in line with our protocols, and our ultrasound transducers are covered with disposable covers, and the ultrasound probes are cleaned thoroughly between patients. Many clinicians think that these measures are excessive and unnecessary, but we believe they are important demonstrations of our commitment to infection control. Prior to treatment, all patients receive advice about their available treatment options in line with NICE guideline CG 168. They are consented in line with recent changes in the law, which emphasizes patient-centered information. Treatment during pregnancy is avoided in line with NICE guidance NG 45. Patients are assessed for risk of DVT in line with NICE clinical guideline CG 92, and all of these safety steps are recorded in a systematic and consistent manner in our documentation. Patients are given a comprehensive information sheet about their procedure prior to treatment, and they receive a pre-assessment telephone call from our nurse before treatment. In our treatment room, when conducting the vein procedures, all the instruments are sterile, single-use and disposable. The electrical equipment is safety tested regularly. Medicines administered are checked and recorded by 2 members of staff. The WHO checklist procedure is followed, and Sharps handling procedures are followed to reduce the risk of needle stick injuries. Emergency drugs and resuscitation defibrillator are available, and all our staff are trained to immediate life support standard, ILS Resuscitation Council UK. During the endothermal ablation procedure, patients are monitored by ECG, blood pressure, pulse, and oximetry. Many clinics that offer vein treatments under local anaesthetic do not offer continuous monitoring of these vital signs, but we believe they are an important aspect of patient safety. Patient comfort is also monitored by a pain score assessment. Patients leave with a written aftercare advice sheet, and a day or 2 later they receive a telephone call from our nurse to assess their progress. Information on our post-procedure advice sheet is reinforced during the telephone call, and any issues that may have arisen are addressed. Key information from this telephone call is recorded in a systematic manner. The effectiveness of our treatments is reviewed against nationally published guidance such as the NICE Quality Standard QS 67 and the Royal College of Surgeons Vein Commissioning Guide. The effectiveness of our vein clinic is reviewed and published monthly in our Quality Assurance Report, which forms part of our governance process. We seek feedback from staff and patients, and we use this feedback to improve our service. Feedback is published widely on our website, which also explains what we do with this feedback and how we modify what we do. We aim to be a responsive organisation. The clinical pathway for endothermal ablation is available on our website, and the link is provided below. The clinical pathway provides clarity on how we manage patients suitable for treatment by endothermal ablation, and it demonstrates how we strive to be a safe, effective and responsive organisation.